Hey everyone, this is Peter with Physical Therapy TV. In today's video we are going to discuss impingement syndrome of your shoulder or shoulder impingement. Specifically the two types of shoulder impingement that you get. Just as a general information, shoulder impingement occurs in your shoulder joint when the rotator cuff is pinched between the humerus head and the acromion. This occurs for a few reasons which we'll be getting into this video, but it can be a very painful condition, leading to pain and swelling in your shoulder joint, causing scar tissue in the joint itself, and leading to weakness of the rotator cuff muscle itself. So there are two main reasons why you get shoulder impingement. Primary would be impingement due to your anatomy, something that you can control, and that would be like, for example, with a hooked tip of the acromion, in this picture below. Most people are born with a type 1 or type 2 acromion. The acromion is this portion of the shoulder blade located right here in the shoulder. When you have this hooked tip, this can cause pressure, and also bone spurs can occur on the tip, which can cause it acting almost like a scalpel, cutting into your rotator cuff tendon and leading to a rotator cuff tear. Obviously impingement first, and this is something that doctors or orthopedic surgeons can address by doing what is known as acromioplasty, where they physically or surgically just remove a portion of the tip of the acromion bone, so that you don't have that pressure on the rotator cuff tendon. A secondary cause for shoulder impingement would be external factors like your activities, postural tightness of the muscles in the front of the shoulder, and it causes the humeral head to shift from its normal anatomical position, and leading to impingement. Most common, it can be attributed to weakness of your rotator cuff, and what happens when your rotator cuff is weak, the deltoid muscle will overpower your rotator cuff muscle, and it will cause the humeral head to slide superiorly in a upward direction, thus jamming down on the bursa and rotator cuff tendon itself, and so just impinging the cuff between the humeral head and the acromion. Now the dangers of not addressing shoulder impingement is that it can lead to a rotator cuff tear that can really be a serious condition. So your symptoms might include pain reaching behind your back or overhead. It will include a loss of strength. It's very important that you get an accurate diagnosis of your shoulder, and after you've got an accurate diagnosis, that you address the flexibility and strength of the muscles in your shoulder joint. We created a free report available at theshoulderreport.com. You can get it by clicking on the video below, and that will give you some free information on how to go about addressing shoulder pain.